If you or someone you know is being checked for lung cancer, the process usually starts with a few common steps. First, doctors will talk with you about your medical history and any symptoms you might be having, things like a cough that won't go away, chest pain, trouble breathing, or unexpected weight loss. Sometimes lung cancer is suspected because something unusual turns up on a routine chest X-ray or CT scan, even if you don't have symptoms. The next step is typically imaging tests. A chest X-ray is often the first tool used, and it can show if there are any lumps or spots in the lungs. If the X-ray finds something suspicious, a CT scan gives a much clearer picture, showing the size, shape, and exact location of any abnormal area. In some cases, doctors may order a PET scan to check if the cancer has spread elsewhere in the body. If these images suggest lung cancer, the only way to know for sure is to get a sample of tissue from the suspicious area, a biopsy. There are a few ways doctors can do this. One common method is bronchoscopy, where a thin, flexible tube with a camera is gently guided through your mouth or nose into the lungs to look around and collect samples. Another way is a needle biopsy, where, using a CT scan or ultrasound for guidance, a needle is inserted through your chest wall to grab some cells from the spot in question. If you're coughing up mucus, they might also examine that under a microscope for cancer cells. This is called sputum cytology. If there's extra fluid around your lungs, a procedure called thoracentesis can remove some of it for testing. And sometimes, if the other methods can't get enough tissue, a small surgery, like video-assisted thoracoscopic surgery, VATS, may be needed. Once a sample is collected, a pathologist examines it under a microscope to see if cancer cells are present and to figure out what type of lung cancer it is, either non-small cell or small cell. Sometimes additional tests are done on the tissue to look for specific genetic changes, which can help guide treatment decisions. Finally, before starting any treatment, doctors might order blood tests and check how well your lungs are working. This helps them understand your overall health and plan the best approach. So, in short, diagnosing lung cancer involves a series of steps: spotting something unusual on imaging, confirming it with a biopsy, and then running extra tests to learn as much as possible before deciding on a treatment plan.